Hello and welcome to Social Work in Healthcare. I'm Janine Mariscotti from the Social Work Department at LaSalle University, and our guest today is Mary Oleksiak. She's an outpatient oncology social worker at the Rosenfeld Cancer Center at Abington Memorial Hospital. Welcome, Mary.
Thanks, Janine.
Tell us a little bit, if you would, about your different experiences in social work. Would you start with that?
Okay. I guess I can say that I've been a social worker for 33 years this summer, and I am a graduate of the program at LaSalle. And I've worked in a variety of different settings in social work over the past 34 years. Started out working with juvenile delinquent boys in a residential treatment setting. I've worked with older adults in their homes for programs trying to keep them safe at home and coordinating resources for them. I have worked at an employee assistance program as an intake counselor, and I think at that point I branched into hospital social work, and I've kind of stayed in healthcare pretty much from that point forward, and that's been since 1990, so however many years that is.
Okay.
It's a long time.
So something about social work and healthcare really is a good fit for you, or something about it that you really enjoy?
It clicked for me. Yeah, there was an intrigue about healthcare, just watching it from afar, visiting people at the hospital, and once I got the opportunity to work in the hospital, there was just something I really liked about the interdisciplinary feel in the hospital. There are things that are challenging for social workers in the hospital because so much of healthcare is driven by insurance nowadays. And so a lot of what we do, a lot of what the healthcare team does is all kind of driven by the insurances. And though I don't really like the president that I'm about to quote, I do feel like part of what social work does, particularly in a hospital setting, is make it a kinder, gentler place. Because we try to really educate our patients about their insurance and about what makes the insurance tick in terms of what the hospital can provide for them. Social workers in a hospital setting do a lot of discharge planning, particularly for older adults, but also for chronically ill younger patients as well. Right. In terms of making sure that people have the services that they need when they leave the hospital, whether that be to go to a nursing home for rehabilitation or to an acute rehab unit, or for home care services so that they can be monitored in their own home. And in each of those services, there are social workers as well. So there's lots of opportunities for social workers in healthcare.
Yes, and a lot going on in healthcare.
A lot going on in healthcare.
Our country right now. So it's in the news a lot.
It is.
Maybe you would talk with us a little bit about some of the major issues in healthcare that are facing Americans at this time.
Yeah, I think the biggest thing that we've been hearing a lot about is not only the passing, but the rollout of the Affordable Care Act, or what a lot of people call Obamacare, but I don't like to call it that. I like to call it the Affordable Care Act because that's what it is. And I think that we're probably, in hindsight perhaps, or I feel like even now can say that it's probably the most important piece of healthcare legislation of our generation, because it is the beginning of being able to offer all of the people in America an opportunity to have healthcare coverage. And up to this point, we've had as many as 46 million people in our country who have no healthcare coverage at all. So there are people who hesitate to go to their hospital, to a doctor, even to the emergency room when they feel things changing in their bodies because they're afraid because they have no insurance. Right. And therefore, a lot of people get diagnosed with serious illnesses at a much later point when it's harder to really offer appropriate treatment because they've delayed the diagnosis for so long because of not having insurance. So now with the Affordable Care Act, people have the opportunity. Not everyone is getting covered under it in this first sort of wave in 2014, but there was an open enrollment period for several months, which is now passed as of March 31st. But there are some exceptions, and there's lots of information on the website that we've heard a lot about, healthcare.gov, and there are still exceptions for being able to go back and look at the possibility of applying for health care. And I just want to kind of highlight, excuse me, several of them. One is if you already started an application on the website and either had technical problems or an error message came up, or you entered your immigration status and it actually entered incorrectly, you can go back and kind of restart those applications. If you didn't finish an application because of a natural disaster, an earthquake or power failures, which we had some of this winter in the Philadelphia area, but if that preceded you from completing the application, you can go back and look at that. And
it sounds like you are recommending that or encouraging people to
absolutely
to do that.
To see what's available. Another thing is if you're a victim of domestic violence, you can now still go and enroll outside of that, common open enrollment period. If there was any life-changing event as defined on the website. So to me, the website is a lot of information. Don't be afraid of it. Just go on healthcare.gov. You get a lot of questions answered. There are links to other agencies or organizations that can help answer your questions, where you can actually talk to people on the phone or by the web and try to get some of your questions answered. It's a very easy, I found it easy. I've done it with some of my patients to go on and kind of do a screening to see what would you qualify for. What kind of policy are you looking for? Are you looking to cover an individual or a family? Do you need medical coverage or dental coverage? What's your income or your expected income for that year? And then that kind of sets you up to see what kind of premiums you'd be paying and what your exact coverage is. And you can go in and browse different policies. And depending on your situation, you can find the premiums quite reasonable. I mean, for probably the middle class working people, you're still going to pay a couple $100s a month. But for people who are really, I don't want to say impoverished, because medical assistance is available for the truly impoverished, but for those people right above that, there are policies for very reasonable prices. I have one patient who's paying as little as 53 cents a month for new health care. And it empowers people to feel like they have some control over their own health care and lives, because now they have their own insurance and they don't have to rely on the state, and they don't have to rely on charity care of a hospital or something like that, but can have their own plan and feel, some power from that and some control over their life from that, and that's good.
So insurance is, would you say, the major issue in healthcare? I mean, there are certainly others, but is that?
It's certainly a big one. Obviously there's a lot of other issues. There's a lot of people out there who have chronic illnesses, who are needing, medications, and there's lots of new medications that are coming out for all illnesses. Sometimes it's hard to get access to those. That's one of the things that social workers who work in healthcare do. That's kind of what I mean when I say we make it kinder, gentler. We educate our patients and we try to link them with the resources that they need, so that they can get not only the healthcare services that they need, but the medications that they need, treatments that they need, and to provide some support along the way for some of the psychosocial distress that comes from having those chronic illnesses. And if the social workers in the hospitals don't have the time to do that kind of, counseling and support, then we can certainly refer patients to get them that kind of help that they need.
And some other issues, in addition to the issues around medication, new medications, getting access to medication, and the insurance, other things that you're seeing as a healthcare social worker that you would say are the sort of major issues or most salient issues right now in the field?
For social workers or for patients?
For patients.
For patients.
For the community.
I think what I hear, it's all driven, what I hear is driven by insurance and finances, and what that's going to mean to patients in terms of dealing with their illnesses. As you said, I work in the outpatient cancer center at Abington Hospital, And when I started that position, I was told that I'd be doing a lot of counseling for people because they're dealing with cancer, and that's a devastating illness.
Right.
And it is. But I spend the majority of my time counseling people about the financial impact of the disease, because it is so devastating. That becomes more of the issue that we talk about than the emotional aspects of the disease itself, or how to, cope with their children and tell their children about that, how to relate, with other family members and support systems around the illness. A lot of it, those issues come up sometimes, but the salient issue is the cost of care, how to deal with the finances, how to pay the bills when you're not working as much, and paying more for medicines. So that has been what I find, a lot of my time is involved in.
Wow.
And I think the important thing for patients and people to remember is that there are a lot of resources out there, and social workers are the brokers to those resources. So if you're in any kind of healthcare setting, ask to see the social worker so that that person can try to connect you. We can't read your minds. If you let us know what your needs are, we can try to help with services and referring you to the right people that can assist.
Is it your experience that other professionals in healthcare will inform patients that there's a social worker available, or it also sounds like you're suggesting that the patient really advocate for themselves and say, I need to see a social worker, I want to see the social worker.
It's good to do that, but I think that in most settings, the other staff, because
Nurses,
issues come up
physicians.
that they can't deal with, so they say, you need to talk with our social worker.
Okay.
She knows everything.
Is that right?
Yeah, they think that we have a magic fairy wand.
That's such an interesting thing in healthcare, because we think of the physician and then maybe the nurse as being more powerful than the social worker. So I think it's interesting to hear that the experience is go to our social worker, she'll know what to do.
For certain social situations,
sure.
or the need for concrete services, go to the social worker.
Yeah.
So.
So when we're going to have to stop for a commercial break. When we come back, I'm hoping that you'll talk a little bit more with us about the range of possibilities for social workers in healthcare, because I know there are many. So we'll do that when we come back. And
Sounds good.
This is Social Work in Healthcare. I'm Janine Mariscotti from the Social Work Department at LaSalle University. We'll be back in a moment.
Yeah, I'm running late. I'll be right there. What? Hello? Oh, really? 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 Oh, finally.
Hi, and welcome back to Social Work and Healthcare. Our guest today is Mary Oleksiak. Mary is the outpatient oncology social worker at the Rosenfeld Cancer Center, Abington Memorial Hospital. Thanks for being with us again. I wanted to ask you a little bit about the range of opportunities that there are for social workers in healthcare. We talked a little bit about hospital work, but I know there are plenty of opportunities, different aspects of healthcare that social workers could be involved in.
Right. So obviously, you know, the hospital is one place, and then within the hospital, there's a lot of opportunities. I mean, I did inpatient social work doing discharge planning for probably 10 or more years. And then there are outpatient locations like in the cancer center, not necessarily based in the hospital, but another big place for social workers is in dialysis units, because those patients who are that chronically ill and or elderly need to have a social worker to help them with a variety of issues in dialysis, as well as support, because it's a difficult, you know, illness and treatment phase to go through. There are social workers in nursing homes who are there very much to meet the psychosocial needs of the population in the nursing home, and to act as a patient advocate and a support to the residents. I always say patients because I'm used to a hospital, but to the residents in nursing homes, as well as to their families, to help adjust to nursing home life. And then there are other facilities that are more of rehab facilities, like acute rehabilitation facilities that deal with people after strokes and brain aneurysms and you know, hip replacements. And there's social workers in those settings as well. A lot of the focuses in any kind of a residential or inpatient setting is going to be that of discharge planning to help with the transition from the inpatient stay to the home. Make sure that a person has the right equipment that they need, home care services if they need, to be referred to programs that will provide meals, or ongoing services through places like the Philadelphia Corporation for Aging or the County Area Agency on Aging. The social worker is going to work on all those kinds of issues. Another you know, venue is hospice, both inpatient hospice and at-home hospice.
Could you talk a little bit more about hospice? Some people might not know exactly what we mean by hospice.
So hospice is a program and a philosophy of care for patients who, to the best of a doctor's ability, are expected to live 6 months or less, or from a cancer diagnosis or any other serious chronic debilitating illness. And it's not a place that patients go, it's a program to care for them. It can be in their own home if they have family members and support people who can help with their care. And it's a transition in approach of care from aggressive medical treatment to changing the focus to keeping a patient comfortable, and to you know, withdraw from the aggressive treatment and look at symptoms and manage those symptoms in home with medications, with holistic approaches, with, you know, supportive counseling, pastoral care. And it's a real team approach with the doctor, a nurse, a home health aide, a social worker, volunteers, and it really, I think, helps to offer an opportunity for people to, you know, die in their own homes with some dignity. And I know that's a hard, you know, thing for people to think about and talk about, but as my mother told me a long time ago, death is a part of life, and we need to kind of grasp that. And, you know, people have the opportunity to make some decisions about how they want to approach that phase of their life. And social workers are very much a part of that.
That process. And some people would ask this question, I'm sure you get it all the time, not just about hospice, but about other things. Will my insurance cover it?
Most insurance policies have a hospice benefit. Medicare has a very thorough hospice benefit that provides, and most hospice benefits with insurance companies provide not only the care, but equipment that's needed at home, some of the medications. There are very few commercial insurance plans that don't have a hospice benefit, in my experience, particularly in this area. So, yeah.
And what about opportunities for social workers at the BSW level versus the MSW level in healthcare? Because sometimes we'll hear only MSWs in this particular field. Are there opportunities for?
I think there still are some,
BSWs?
although it is getting more and more specialized and
Okay.
requiring MSW more. I started out my healthcare transition as a BSW, and I, quite frankly, applied to an ad that said MSW preferred, and I decided to respond to it anyway. And I had a good background, and I had a great BSW education from LaSalle University, and I was able to sell myself into that position. A lot of the hospitals in the Philadelphia area at this point are requiring MSWs. You can, hospice actually, you can work as a BSW. A regular home care service agency that's not hospice, they require an MSW or an MSW supervisor who can sign off on your records.
Right, okay.
The dialysis units, I believe, you do require an MSW. Nursing homes, you can hire with a BSW.
So there are some opportunities.
There are some
really
opportunities.
at both levels. Yes. Okay. So you mentioned LaSalle's social work program. So maybe you'll give us a little bit of your thoughts about your education at LaSalle.
Yeah, I still.
It was yesterday.
It was yesterday, but I still think very highly of my education at LaSalle, and I say that as a person who's also a recent MSW from another program. We don't have an MSW program here at LaSalle. And a lot of the MSW programs in the area are much larger than the social work program here at LaSalle, and I think that I like that sort of smaller, more personalized feel at LaSalle. I really feel like I got the individual attention that I needed from my professors, from my peers, to really foster my growth, not just as a professional, but to really kind of, I grew up in kind of a sheltered environment, and I needed to be able to open my eyes and look at other people in a very non-judgmental way, because that's part of our code of ethics in social work, and to allow people, the right to their own decisions, and respect that. And that was ingrained in me at LaSalle, very much so. I think the social work values were very heavily emphasized. I think the program was like a good sort of generalist enough approach that it offered me great opportunities. I mean, when I think about the things that I did as a bachelor level social worker for the bulk of my career so far, to have been able to go from, working with delinquent boys to elderly people in their own homes, and lots of opportunities in between, I think I really got my money's worth out of my bachelor degree from LaSalle.
So you really felt that the BSW at LaSalle gave you that opportunity to have that breadth of experience.
Yes, very much so. I mean, I think I was in the field about 20 years before there was one job that I went for that I didn't get.
Wow.
And it was because they needed someone to be licensed, and in Pennsylvania you can't be licensed unless you have a master's degree. But at that particular point, there was another position that was open that was called a community education coordinator, which was a little tiny step away from social work, but it was all about relationship and relationship building and networking with other hospitals to foster a referral base for a rehab unit that I worked in. And so I was able to sidestep the master's degree for a few more years until I took this outpatient oncology position, with knowing that the requirement would be that I would go back and get my master's degree.
Right.
So I did that.
So you really practiced with your BSW for quite a long time.
I did. I did. And I was also fortunate enough to have the opportunity to come back to LaSalle and to be an adjunct faculty member here at LaSalle, because I was asked to develop and teach a course on healthcare and social work, or social work and healthcare. And because I kind of had an expertise in that field, I was able to teach it as a bachelor level social worker. And now it's a permanent part of the curriculum. And because I have my master's degree, I'll be able to continue to do that. And I've also had the opportunity to mentor some students in teaching a few field experience courses, and also to supervise a few LaSalle students in the field with me. So I've really valued the BSW program at LaSalle enough to be able to do that.
And what do you see in some of the students that you have mentored or supervised in the field? Anything particular about a LaSalle social work student?
I don't have a lot to compare to, although I am going to supervise a student from another program next year, so it will be an interesting experience. I'll come back and tell you. But I think I have the sense that that same good, solid foundation is happening at LaSalle. The students are coming in with that. They understand the values. They understand the role of social work. And they're just kind of growing in their field experience. And I think they feel like they have a good source of support here at LaSalle to go back to when they're unsure about things in the field. So I get the sense that it's still a very good program.
Are there any closing points that you would like to make, either about the issue of healthcare in general or about social workers and healthcare before we end in a couple of minutes?
I think there's a lot of great opportunities out there, and social work is and will continue to have a major role in healthcare with the changes that are coming on board with the Affordable Care Act, and with the emphasis on, people not spending as much time in hospitals and having more outpatient services. And I hope that people will consider social work within a healthcare profession as a way to work in healthcare.
Great, thank you so much. Our guest was Mary Oleksiak, and this is Social Work in Healthcare. I'm Janine Mariscotti from the Social Work Program at LaSalle University. Our program is growing. We have day and evening, full and part-time and accelerated programs. Please come and join us. Thank you.
Thank you.